Have you ever wondered why some men are circumcised while others are not? Is it purely a cultural or religious decision, or does science say something more? In this video, we're diving deep into one of the most personal and debated topics in men's health: foreskin versus circumcision. This isn't about telling you what to do. It's about understanding your options. We're cutting through myths, emotions, and misinformation to give you clear, evidence-based insights that can help you make an informed choice. By the end of this video, you'll know exactly how the foreskin functions, the benefits and risks of circumcision, and the medical conditions that might require it. So stay tuned, because this is the conversation too many men aren't having, and it could change the way you view your own health. Let's begin with the fundamentals. What is the foreskin, and what does it actually do? Medically known as the prepuce, the foreskin is a retractable sleeve of skin that covers the head of the penis, or glans. At birth, it's usually fused to the glans and becomes fully retractable over time, typically by adolescence. But this isn't just a flap of skin. It serves several important biological roles. First, it acts as a protective barrier, shielding the sensitive glands from friction, bacteria, and environmental irritants. This is particularly helpful in infancy and adolescence, when hygiene habits are still developing. Second, it helps retain natural moisture and lubrication. The inner lining of the foreskin creates a moist environment around the glands, which can enhance comfort during sexual activity. Finally, the foreskin is packed with thousands of highly sensitive nerve endings. For many men, it plays a meaningful role in sexual pleasure and sensation. So, why remove it? While circumcision has been practiced for religious and cultural reasons for thousands of years, modern medicine has introduced new arguments into the conversation. Today, many men and parents consider circumcision for purely medical or hygiene-related reasons. Let's take a closer look at the health benefits that science has uncovered. First, hygiene becomes easier. An exposed gland is simpler to keep clean, reducing the risk of smegma buildup, a harmless but often odorous substance made from shed skin and oils. When smegma accumulates due to poor hygiene, it can lead to bacterial overgrowth, inflammation, and infections. Circumcision eliminates this risk almost entirely. Another major advantage is the reduced risk of infections. The space between the glands and the foreskin can trap moisture, becoming a breeding ground for bacteria. This can lead to conditions like bullonopostitis, inflammation of both the glands and foreskin. Circumcision dramatically lowers the risk of these infections. More importantly, in infants, it's been shown to reduce the chance of developing urinary tract infections, UTIs, especially during the first year of life, when UTIs can have serious complications. But the most widely researched benefit is the reduction in risk for sexually transmitted infections, STIs. Numerous high-quality randomized controlled trials, particularly in Africa, have shown that circumcision can reduce a man's risk of acquiring HIV through heterosexual intercourse by up to 60%. These findings, published in respected journals like The Lancet, have shaped public health policies worldwide. The benefits don't stop at HIV. Circumcision also reduces the likelihood of contracting HPV, the human papillomavirus, which is a major cause of cervical cancer in women and penile and throat cancer in men. Studies also show a lower risk of herpes simplex virus type 2, the cause of genital herpes. How does this work? The inner foreskin is thin, rich in immune cells, and highly susceptible to viral entry. Removing this tissue reduces the number of entry points for infection, essentially acting like a physical barrier. However, and this is critical, circumcision reduces risk. It does not eliminate it. It's not a vaccine or a magical shield. Safe sex practices, particularly condom use, remain the most effective defense against STIs. Another benefit of circumcision is a lowered risk of penile cancer. Though rare in developed countries, penile cancer is closely linked to chronic inflammation and HPV. Circumcision addresses both these risk factors, thereby lowering lifetime risk. With all these potential benefits, it might sound like circumcision is a no-brainer, but we must consider the other side. No surgery is without risks, and circumcision is no exception. Even when performed by trained professionals in sterile environments, it carries a small but real chance of complications. Pain is a universal factor, especially in the days following the procedure. There's also the risk of bleeding, infection, and improper healing. In some cases, too much or too little skin is removed, leading to cosmetic dissatisfaction or even requiring corrective surgery. But the most talked about downside is the potential change in sensation. As we mentioned earlier, the foreskin is densely packed with fine touch nerve endings. Removing it changes the sensory landscape of the penis. Over time, the exposed glands undergoes keratinization, meaning the skin becomes thicker and slightly less sensitive due to constant friction from clothing. While many circumcised men report no change in sexual pleasure, others say they experience reduced sensitivity. This is highly individual and subjective, but it's a legitimate consideration. Another point worth noting is the loss of natural lubrication. With the foreskin gone, the glands is exposed to constant friction, which can cause dryness or discomfort during intimacy. These aren't necessarily deal breakers, but they are real physical changes worth acknowledging. And for many men, sexual performance goes beyond the foreskin. If you've ever struggled with achieving or maintaining a firm, confident erection, you're not alone. There's a growing body of research into natural, science-based solutions that address performance at its core. One intriguing breakthrough comes from a biomedical engineer who discovered a bizarrely simple 7-second remedy that targets the real root cause of performance issues. No pills, no injections, no side effects. If you're curious, just point your phone camera at the QR code on screen or check the pinned comment below. The science behind it is eye-opening. Now, let's return to our primary focus. In what situations does circumcision shift from a personal decision to a medical necessity? The most common medical indication is phimosis, when the foreskin is too tight to retract over the glands. In mild cases, it can be managed with steroid creams or gentle stretching. But in severe cases, it can hinder hygiene, cause recurrent infections, and make erections painful or difficult. A related condition is paraphimosis, which occurs when a tight foreskin is pulled back but cannot return to its original position. This creates a tourniquet effect, cutting off blood flow to the glands and requiring emergency treatment. Men who suffer from chronic infections that don't respond to medication, such as melanopostitis, may also benefit from circumcision as a permanent solution. In these cases, surgery isn't optional, it's medically necessary. For everyone else, the choice depends on personal beliefs, health priorities, and lifestyle. Parents making this decision for a newborn often factor in religion, culture, or preventive health benefits. Adults considering circumcision typically weigh health advantages against risks, aesthetics, and personal values. In conclusion, the foreskin has clear, scientifically supported biological functions, especially in protection, moisture, and sensation. Yet, circumcision offers significant health benefits, particularly in lowering the risk of infections and improving hygiene. Like any medical decision, it comes with trade-offs. It's not a one-size-fits-all answer. Every man's body, lifestyle, and preferences are different. What matters most is making an informed, thoughtful decision. If you're experiencing discomfort, tightness, or repeated infections, speak to a healthcare provider, ideally a urologist. They can examine you, discuss your concerns, and offer guidance tailored to your specific situation. Avoid making health decisions based solely on internet opinions or social media comments. Rely on evidence. Rely on science. And most importantly, rely on a qualified medical expert. We hope this deep dive helped you feel more confident and informed. If it did, please hit the like button, subscribe for more factual health content, and share this video with someone who might benefit from it. Your health is your power. Understand it, protect it, and take control. Thanks for watching.